Good morning. I'm Dr. Amy Moon. I'm here to talk a little bit about Votiva, which is a new tool from InMode. We have 3 different options on the Votiva, and the one that I'm specifically going to talk to you about today is called the Aviva. This is the tool that goes with it. Some people say it might look scary. I don't think it's particularly scary. But before we go into what this does, let's talk about what a labiaplasty is and why a woman might want one. So we're all born looking a little bit different. We're taller, we're shorter, we come in all different sizes. And the first message I want to send out to the women that I take care of is there's no need to change anything about you. You're fine the way you are. But there are still women who feel like over time with the aging process and the delivery of the children that their labia or their female genitals don't look the way that they used to look. Some women might experience a lot of laxity in the skin or elongation of the tissue. There might even be defects present from the birth of a child that they find not only cosmetically not appealing, but physically it can be quite bothersome. Some of the symptoms that women might have from excessively long labia could be rubbing in their clothes or in their underwear. It might make them uncomfortable to wear a bathing suit or any other tight clothes that are fitted in that area due to the excessively long size. Some women also talk to me how it interferes with their sexual function in terms of the length causing pain and discomfort. So this is more than just a cosmetic procedure. This is also a procedure that's done for functionality, for self-confidence. I truly believe that many women would benefit from it and that might be too afraid to ask or even discuss it with their healthcare providers. So people ask me, how is it done? Traditionally, a labiaplasty would be done in an operating room. And in the operating room setting, you would be put to sleep under a general anesthetic. Once you'd be off to sleep, the tissue would be injected with a local as well. But the tissue at that point is either cut or it's excised, it's trimmed down. Large amounts of tissue gets removed in order to get the result that we need. And that requires a lot of stitches and suturing. What does that mean? It means a lot of downtime. And then it can mean a lot of swelling and pain and long-term recovery. And even though the end result can turn out to be fabulous, that's still a big procedure to go through. And a lot of women wouldn't want to undergo a procedure that's going to be really painful with a lot of downtime, even if that end result is good. The other thing to consider is the cost. When we go to a hospital setting, there's fees included being in the operating room, having the anesthesiologist put you to sleep, and the surgeon's fees on top of that. Insurance doesn't always cover these types of procedures, and so some people might be faced with wanting it done but not being able to afford it. So the reason I'm very excited about the Aviva is for all the things that we hope to achieve, we can get a minimally invasive option with minimal downtime, easy recovery, low cost, and you still get that great cosmetic result. So I feel like this will make the option available to more women and they'll feel more comfortable with it. So now we'll go back to what the tool does and exactly how it works. If you were coming in to have this procedure done today, you wouldn't have to have any particular pre-op instructions other than just to come in having showered and clean. Once you're here, we don't have to give you any shots or anything like that, no anti-nausea medicine. We just really, once you're here, and we can get started. The labia can be injected with a local anesthetic that also has a steroid in it, such that once we've localized that anesthesia, we consider this pain-free. There should be no pain involved whatsoever. The tip of this tool does get inserted under the skin. So we make a small hole and it goes into the skin, and then on top goes the opposing device. And what's going to be happening at this tip is energy is going to be going back and forth and back and forth. The energy is applied only on the outward fashion. So the tool gets put inside, gentle pressure gets applied, and then we apply the energy source as I pull backwards. And then we slide back in, rotate, pull it back out again. Each treatment area that we do takes 30 to 60 seconds. and we treat a multitude of areas. We'll treat the entire mons pubis, and we'll fan it from the patient's right to the left. We'll also treat the clitoral hood, the labia majora on the outside. We can treat the labia minora, then the perineum and the perineal body. So this is holistically the entire outside portion of the female genitals. We don't put the tool into the vagina. It's not appropriate for that. It's meant to be external only. What the heat does is it shrinks the tissue and it burns the fat. And the results are not instantaneous. They happen slowly over time. Most of the pictures that we can put on our website, the befores and the after, are over a 6-week period of time of healing. You can expect to see even more improved results over 3 months, 6 months, and 12 months time as that tissue continues to recollagenize and heal. Really, the biggest risk of the infection would be bleeding at the time. You could see a superficial skin infection. If you weren't using proper technique, you could burn the skin, so it's important that you keep a lot of gel on there while you do it. Immediately, we have people go home with an ice pack that they place onto the perineum. Most women are going to ice on average for 1 to 3 days. The swelling should be resolved at that point. After that, you might just experience some slight bruising. The women that we've taken care of have said that it's very tolerable, and the effects really begin to kick in very quickly.